Hello, welcome to sonography-radiology training channel. This series of videos is about umbilical cord imaging. This is the fifth video in this video series with title of umbilical cord masses. I will try to briefly explain all the possible diagnoses for umbilical cord masses in a few consecutive videos. This is the first video in this field for explanation of umbilical cord teratoma. Nodular bulges of the umbilical cord are rare entities of polymorphous presentation that can be detected prenatally by ultrasound examination. There are many differential diagnoses for an umbilical cord tumor. The clinical significance common to all of these anomalies is determined by their size, which can potentially cause vascular compromise and affect fetal growth. After birth, umbilical cord clamping should be distal to the lesion to avoid intestinal strangulation. An ultrasound investigation of the lesion is recommended, and referral of the newborn to a pediatric surgery clinic for revision and correction is mandatory, but not an emergency. Umbilical cord teratoma. Umbilical cord teratoma is a polymorphous congenital nodular cystic neoplasm having different cellular and organoid components deriving from more than one germ layer. Umbilical cord teratoma is uncommon only as case reports. Prenatal diagnosis. They are often detected during routine prenatal ultrasound scans as masses with both solid and cystic areas. Is there any potential complications for umbilical cord teratoma? It can cause fetal hydrops, cardiac failure, or fetal demise if they are large or interfere with fetal circulation. This prenatal grayscale ultrasound image obtained at 37 weeks gestation demonstrates a heterogeneous echogenic mass attached to and involving the umbilical cord. Color Doppler image demonstrates little blood flow within the mass, and the mass is closely associated with the umbilical cord and compressing the umbilical cord vessels. Is there any associated anomalies with umbilical cord teratoma? Usually considered benign, but this article review showed that about 50% of all reported cases are associated with other malformations, such as omphalocele, hydrocephalus and CNS problems, bladder exstrophy, and etc. How we must manage a fetus with umbilical cord teratoma. Close monitoring with short interval ultrasound is recommended. In summary, umbilical cord teratomas are rare tumors with a complex structure and the potential to cause complications requiring careful monitoring and management during pregnancy. If we want present and rapid guideline for umbilical cord teratoma, we can say it's uncommon only as case report. Its prenatal diagnosis possible by prenatal ultrasound scans, which we can find a cystic solid umbilical cord mass. The possible complication for umbilical cord teratoma is hydrops, cardiac failure, and fetal demise. About 50% of cases are associated with other anomalies, and management is close monitoring with short interval ultrasounds. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.